New research suggests that working remotely full-time can negatively affect people's mental health, despite polls that show people are willing to get paid less for that flexibility. CBS News MoneyWatch reporter Megan Cerullo joins us now. I mean, Megan, there are people who go out of their way to seek these types of jobs. What does the data show about how workers view remote work?
The pandemic really drove this shift, whereas before COVID, only 7% of U.S. workers worked remotely. That figure has quadrupled, and about 28% of workers have the ability to do their jobs remotely. And like you said, surveys show that workers overwhelmingly say that they prize flexibility and are, in some cases, willing to take pay cuts in exchange for the ability to work from home or wherever they want. And that's because we all face inconveniences like commuting costs in some cases. But there are less visible longer-term costs to the kind of isolation that comes with remote work.
Yeah, I mean, anecdotally, some people either love it or hate it, right? They're either like, oh, I want this, or like, oh, I could never work from home, I'd go crazy. So what is the data showing?
The data looked at groups of workers that had the ability to do their jobs from anywhere versus those that were required to go to an office or a work site. And what it found is that there was a substantial rise among those workers doing their jobs remotely in the chances of them not interacting with a single other person throughout the course of the day, not even a hello to a neighbor or an interaction with a barista. And that kind of isolation leads to negative mental health outcomes. That same group of workers also reported more visits to mental health care providers, greater uptake in psych meds. And that wasn't just because they had more time to visit doctors, because there was no tandem rise in other kinds of doctors' visits. And so it's worth weighing those immediate, very visible inconveniences of commuting against these less visible and potentially damaging longer-term costs of the isolation that can sometimes accompany remote work.
I mean, one of my takeaways is don't negate the power of community. Would you agree?
That's a really good point. And even doctors have for a long time tried to iterate how important relationships are to people's physical health and well-being. And even that interaction with a stranger at a grocery store can actually go a long way.
And this counts. Megan Cerullo,
Absolutely,
always love seeing
it
you.
does.
See you again soon. Thank you.